Did you know that the growth of the ASC or ambulatory surgical center market in healthcare, do you know what that number is? Well, from 1999 to 2011, so you're talking about 10 years ago, the growth went from 2,600 a year to now the growth of ASCs in in the healthcare is over 6,000 in the country. And so, with the growth of ASCs, this steep of a growth, it has created a lot more need for pharmacists practicing in surgery center, and that's what this training is all about. So, let's talk about that. So we want to get to work with some of those surgery center as clients, right? We're consultant pharmacists, valued healthcare professionals, and we want to get a piece of this pie to practice and help the surgery center manage their medication. My name is Lorraine Charles Huston, and I'm going to show you how I get ambulatory surgery center as clients for my pharmacy consulting business. The nature of consulting, let's talk about that. So, the nature of consulting is that starting a consulting business is hard. It's not a get rich quick thing. Consultant pharmacy, any type of consultant, really, in general, you need clients. And so starting off, they don't come overnight. But when they come, they are sustainable and you can have clients for years and years and years. I just had a friend retire as a consultant pharmacist, and one of his facilities, he worked with them for the past 17 years. He was a consultant pharmacist. So that's the first point. The second point is, if you are not genuinely interested in working with surgery centers and helping them with their medication management processes and systems, then don't even bother, because I'm here to tell you it's difficult to get in there, but if you steer the course and you stick with it, you will get clients, and I'm going to show you how I got my clients, and I've done very well. And you also have to be ready to work very hard at being a good consultant. These surgery centers, they are taking care of people, right? It's surgery. And so you want to make sure that you do a good job for them. So you want to stay on top of any new rules and regulations that are coming down the pike. And another thing about surgery center consultation is it's a great side job to have. If you are looking to supplement your full-time job and you just want to do something that's not going to take a whole lot of time, but you can get in, do a good job, and get out, surgery center consultant, I think, is one of the best kept secret as a pharmacist consultant. And I'm going to show you how I'm able to get clients. So the first thing that I do is to let me make that smaller. The first thing you need to know is that you have to go and find your clients. They are not going to magically find you. Okay. So the next steps I'm going to show you, I'm going to show you what I did to get my clients. And I believe even if you implement one or two of the processes I'm going to show you, I believe you can be very successful as a surgery center consultant. So the first thing that I did was to okay. So the first thing I did, step one, was to reach out to anyone and everyone that I know who is affiliated with ambulatory surgical center. And that is really important because if people don't know what you do, how would they contact you? And so, what I did when I started my consulting business, I reached out to people that I know that were working in surgery centers. If I saw a surgery center, I would get the name and I would check them out. I know once they're already open, chances are they have a consultant pharmacist, but that's only in Florida. But in other parts of the country, except I think Texas and California, there's no requirement for a consultant pharmacist. It is strongly recommended that you have someone in your facility that is well versed in medication management system. So all the other states where consultant pharmacy is not mandatory is a huge opportunity for a pharmacist to let these surgery centers know, hey, I'm a pharmacist and I can help you manage your medication. I remember working for my dad when I graduated from high school. I was 17 years old, and my dad had just left a company that he helped to build, and he was now starting his own company. And I was his secretary. And when we opened the doors to his business, that was a long time ago. But when we opened the doors to his business, my dad was letting everyone on that island know what he did, what he had, what he offered, and and he also told them, if I don't have it, I can get it. He was in the import export business. And my dad built a very successful business and it's operational up to this day. So if people don't know what you do, they cannot use you. So that is my first step, to let everyone that you know what you do. And my next step is go to industry conferences. I think this is a huge secret. I have been going to these surgery center conferences for the past 8 years. I have never ever met a consultant pharmacist there as an attendee. In the early years when I started to go, they would have a consultant pharmacist give a presentation, but that hasn't happened in the past 4 to 5 years at the conferences that I have attended in Florida. But going to these conferences, when I introduce myself to people, they're like, a consultant pharmacist? What are you doing here? We don't have, our consultant pharmacists aren't here. I said, exactly right. So the fact your consultant pharmacist is not here means you should hire me to be your consultant pharmacist because I'm here to support your cause, right? And I say that jokingly, but I'm serious. Really, if you're part of an industry, if you're the consultant pharmacist, why aren't you attending these conferences? Number one, it's a great way to meet administrators. Um, they may know of a new center that's opening up, and they will call you. I've gotten referrals from that, and over the past 8 9 years since I've been attending these conferences, I have gotten maybe two direct leads and became their consultant pharmacist. They were literally getting ready to open their surgery center and they were looking for a consultant pharmacist. So I was able to get two clients, but two clients at a conference by just showing up, that's pretty good because two clients translate into thousands of dollars in 1 year. So to me, going to the conferences has really paid off. And so that is the second suggestion that I make. Go to these industry conferences. The third one is you know more than you think. So a lot of times, and I fell into this trap as well, when I was starting my business, I felt so behind, like, I don't know anything about this. Well, I'm here to tell you that's not true. We know so much. 90% of what we need to know to be a good consultant pharmacist, the surgery center, we already know. we've been doing this our whole career, right? So we know more than we think we know. So look at the previous jobs we've had. We've done internships in different facilities, so we've had to meet and work with new people, right? And so we are able to relate to these people, right? One of the big things that has helped me, I became a life coach a few years ago, and it has really helped me to become a better communicator and to be able to read people more. So I figured out, and most pharmacists kind of have this built in as well, I think. So some people you meet and they just want to get to the point, like, I don't want to be chatty chatty. Tell me what you got and send me a proposal. I'll look at it and I'll let you know. And some people, they want to know your life story. So it's important to distinguish the personalities, because again, that will enhance how you communicate with them, how you come across, and how likable you are to them, right? People hire you if they like you and see themselves working with you. So we have that even with people coming into the retail pharmacy and asking us questions, people we don't know, and we're able to help them in a very expeditious manner, because we know the information and we know how to help them, and we can figure out who needs a real basic explanation and who is a little bit more high level that we can help as well. So it's really important to spot our personality. So that's what I mean when I say we're a lot more intuitive and we know everything we need to know. It's just a matter of when you meet these prospective clients that you're able to engage them on their level so that they can hire you. So the fourth one is meet your clients where they are. Get out and introduce yourself to them in the community. So I go out, I will look up surgery centers in my city, and I will get in my car and I will drive to the surgery centers and introduce myself. Yes, I have had people say no, and I've had situation where I went into a surgery center and I said, I just want to introduce myself as a consultant pharmacist. We already have a consultant. I'm like, yes, I know. But if the situation changes, I just want you to have my information. And I have had people say, no, thank you. Here is your card back. And I remember the first time that happened, my ego was so crushed because I'm like, they wouldn't even take my card. And I realized, consulting business is not for the faint at heart. You have to have some mental toughness, and you have, because you're in it and you're in it to win, and you will. And so I think it's a really good thing to literally go and call on these surgery centers, introduce yourself, let them know that you're around, and if a need arises, that you can help them, right? Um, and so my other um, building a website, step number 5. This is like a screenshot of my website. It's not my first one. It's not the one that I built, but this is the website I currently have. You have to have some type of a web presence. When I started my consulting business, I built my website myself. I had a little bit of knowledge, and the internet helped me. I had a little bit of training, and I launched my own website. And that website was what gave me the first few clients that I had, because they Googled and they found consultant pharmacists and they called me. And I had the audacity to be shocked that someone found my website and called me to hire me. It doesn't make sense, right? But that's how I wasn't very confident. But I knew on some level that I had the ability to do the job and be a really good consultant. And time has proven, because I now work with several surgery centers and they're very happy with my services. So, my message to you is step into your greatness today. Don't wait. You're already successful. My gosh, you're a pharmacist, right? You're smart. you know how to deal with people. I gave you 5 steps and how you can go out there and get surgery center clients and become a successful consultant pharmacist. So I encourage you, you're already successful, step into your greatness today. Um, and surgery centers are only increasing. So this graph shows the current and projected growth of surgery centers. So by the year 2025, 2026, we will have so many more surgery centers. And those surgery centers need you to manage their medications in their facilities. And if I don't know if you can see the graph here, but I mean ophthalmology, orthopedic, gastroenterology, pain management, spinal infection, that's a huge area. Plastic surgery, I mean, that's been a staple, and many other procedures. So surgery centers are projected to grow. And you now have the knowledge to be able to position yourself, go out and meet them, introduce yourself, and help them manage your medication, and they will pay you. And you should begin today. Don't put it off. I want to encourage you. Surgery centers are looking for you right now. They need consultant pharmacists. And I just gave you 5 ways how you can get them to be your clients. So give me a call, set up an appointment. Sign up, and I will give you a 20-30 minute consultation if you want to learn more about how I can help you get surgery center as your clients.